Good morning. Welcome to the second annual Oral Health Summit. This was originally scheduled to be an in-person meeting with our colleagues in the north of the state. However, COVID-19 threw us a different curve, seemed to have a different idea. We're not quite ready for the in-person, hopefully soon, but nonetheless, we welcome you in by way of Zoom. I want to thank Lisa and Celeste this morning, Oral Health Progress and Equity Network. You guys did a great job, very informative, very fun, great way to start the day. All right, so let's get this summit on the way. Louisiana Oral Health Coalition is a voluntary collaborative representing oral health interests throughout Louisiana. There are over 40 organizations and other individuals such as dentists, hygienists, pediatricians, nurses, and community advocates who are dedicated to improving the oral health of all Louisianans. The Louisiana Oral Health Coalition is made up of a commitment to improve oral health by utilizing evidence-based best practices that will better use the resources at hand. Our vision, which you see, is a Louisiana where all people of all ages have excellent oral health, and our mission, which is to coordinate the provision of information, resources, and services so that people of all ages can have excellent oral health, are simple, yet they seek to make a profound impact on the areas of access, prevention, workforce, and policy. So a few introductions. You'll see there to your left is Sue Ketchens. She is our chair, also the CEO of Health Centers and Schools in Baton Rouge. The middle is me. I'm honored to be able to serve as the vice chair. And to the right is Annette Doherty. She's our secretary, better known to a lot of y'all as the executive director of the Louisiana Dental Association. All right, so our 2021 theme, as most of you should already know, is the road to achieving oral health equity in Louisiana. We're excited you decided to join us today. It's our hope that you find this summit informative and it sparks a desire in each of you to find a place to get involved, to get plugged in, to how you can personally be a positive influence, a change maker in the road to achieving oral health in our state. We thank you again. We ask that you please stick around to the very end of the presentation. We have excellent presentations to share with you. I'll now turn it over to Michonne Butler with Well Ahead Louisiana. Take it over, my friend, Michonne.
Good morning, oral health stakeholders, and welcome to the second annual Oral Health Summit. My name is Michonne Butler, and I am the Well Ahead Louisiana Oral Health Promotions Manager. I bring you greetings on behalf of our leadership here at the Louisiana Department of Health and Well Ahead Louisiana. We all know that oral health is essential to general health and well-being of individuals and the population, yet significant oral health disparities continue to persist. Reducing oral health disparities is a primary goal for all of us. Today, You'll hear from national and state partners. Our goal today for this summit is for you to leave empowered to develop programs and services to allow equal opportunities for all to lead a healthier life. So, where do we stand? Louisiana ranks poorly for providing oral health care due to limited access to care. 1.8 million Louisiana residents are underserved due to dental hispus. That fills the New Orleans Superdome over 23 times. 86% of Louisiana residents suffer from dental health professional shortage areas. And 2,673,187 Louisiana residents do not have fluoridated water. That fills Tiger Stadium 26 times. In Louisiana, dental care is an unmet need among low-income children, older adults, and also those with special needs. Medicaid eligible children in Louisiana are 3 to 5 times more likely to have untreated dental decay than non-eligible children. In 2019, of 421,526 Medicaid enrollees under the age of 21, only 48% saw a dentist for at least one service. Now, I'd like to share a little bit about our work here at Wellhead, Louisiana. Wellhead, Louisiana is a chronic disease prevention and healthcare arm of the Louisiana Department of Health. Our mission is to connect Louisiana communities to a healthier future.
There's no place like Louisiana. Our meals are never for one. Our music is legendary and it's always turned up. We've got something for every sportsman. Our heritage is rich, and boy, do we have a good time. But there's something else our state is known for. Louisiana leads the nation in a number of statistics related to poor health. 1/3 of our adults are obese. More than 12% of men and 14% of women have diabetes. 30 of our residents die every day of heart disease. You could fill the Superdome 11 times with Louisiana adults who smoke, and 95% of our residents live in a healthcare provider shortage area. But we believe that improving our state's health statistics doesn't mean giving up on the traditions that we love. If we begin making healthy policy, system, and environmental changes now, our children will be able to enjoy our favorite things even longer. Together, we can make Louisiana as healthy as we are happy. Join Well Ahead Louisiana by being a leader in Healthy Starts. Create environments that support a healthy childhood, healthy weight. Ensure our residents have the choice to eat well and be active. Healthy Hearts. Adopt clinical best practices to improve the management of chronic disease. Healthy Smiles. Expand access to preventive dental services. Healthy Air. Connect our residents to quit tobacco resources and ensuring clean air. Healthy Communities. Make the healthy choice the easy choice in the spaces and places where we live, learn, work, and play. Louisiana isn't for spectators, it's for participators. Our state is full of teachers, healthcare providers, mayors, parents, business leaders, and restaurant owners. People like you who can make a real difference. By supporting wellness initiatives championed by Well Ahead, you're helping encourage nutritious meals, disease management, quality health care, active learning, preventive care, employee wellness, clean air, data-driven decisions, and health equity. So bike the nearest trail, fish your favorite bayou, dance the night away to jazz, zydeco, or swamp pop. Eat your favorite Louisiana dishes and join us in making small, smart, and healthy changes. Together, we can move Louisiana's health forward. And when we do, all residents throughout our state will live longer, happier, and healthier.
So this video shared Well Ahead's vision for reducing the burden of chronic disease for all Louisiana residents. Through the following programs, Well Ahead connects communities to tools and resources that help improve the health of Louisiana's residents. Well Ahead works to create healthy smiles through oral health education and by expanding access to preventive dental services. Well Ahead Oral Health Promotion is funded by CDC Division of Oral Health. Louisiana is one of 20 states that receives the CDC State Actions to Improve Oral Health DP 1810 grant. This is the state's third consecutive cycle of 5-year funding. The program current its previous funding has been received from HRSA, Title V Maternal Child Block Grant, Preventative Health and Health Services Block Grant, and one-time dollars from the state. The program has categorized its work in 3 P's for performance: promote, partner, and practice. We partner with the Louisiana Oral Health Coalition and other various community and professional organizations. We promote the awareness and knowledge of oral health and overall health through communications tools and activities. We integrate oral health into other internal chronic disease prevention programs. And our primary focus is to expand school-based, school-linked dental sealant and fluoride varnish programs, and also to ensure Louisiana residents have access and receive safe and optimally fluoridated water. Well Ahead maintains an oral health surveillance system to collect information continuously. We measure oral health disparities and access to dental care in Louisiana annually, oral health indicators annually, and monitor the trends. Identify vulnerable population groups annually. Every 3 to 5 years, the Well Ahead conducts a basic screening survey, the BSS, to collect information on the oral health status of Louisiana third graders. The BSS provides a snapshot of Louisiana's children. School sealing programs. Our last school sealing programs occurred in 2019 and 2020. We screened up 1,217 students, and of those students, 454 received dental sealants. School sealing programs ended in February as the result of the COVID pandemic. However, we continue to provide a wealth of education resources and tools to children aged 6 to 14 through statewide partnerships until these programs resume. We currently work with 32 fluoride adjusting public water systems to initiate community water fluoridation. The following activities are implemented to increase access to care for underserved populations: the coordination of school sealing programs. Again, we target those children aged 6 to 14 within a dental health professional shortage area, providing the application of dental sealants on permanent molars, the dissemination of educational information, informative resources on the importance of preventive dental care to individuals with disabilities and pregnant women, as well as senior adults, as well as the dissemination of data-driven statistics on the importance of community water fluoridation and fluoride varnish to reduce dental caries. For social determinants of health, our work includes increased access to oral health awareness through the development of educational resources. We conduct quantitative and qualitative surveys. We provide opportunities to network and increase access to care through technologies such as teledentistry. Some of our national partnerships include Centers for Disease Control, the American Network of Oral Health Coalitions, the Association of State and Territory Dental Directors, the National Association of Chronic Disease Directors, the National Association of County Health Officials, Open Oral Health Progress Equity Network, and Centers for Health Strategies. Louisiana participated in the recent cohort in 2017-2018 in partnership with our Medicaid program. The Louisiana Oral Health Coalition was created as a deliverable of the first CDC grant received in 2008. The Louisiana Coalition represents over 40 organizations, and there are currently 79 members. The state's action plan, it outlines the combined goals of both the Louisiana Oral Health Coalition and Well Ahead Louisiana. Coordinated efforts include increasing access to oral health services, creating policy changes to improve oral health, preventing the progression of oral disease through evidence-based interventions, supporting the recruitment and retention of a qualified health workforce, providing direction for achieving priorities set forth both by key stakeholders. The plans that provides the direction for achieving priorities set forth by key stakeholders representing individual oral health champions and multiple organizations from across the state. We strive to make the plan available to the public, update the plan every 3 to 5 years, and as well, we evaluate our efforts. Lastly, today in partnership with the Oral Health Coalition, we have released Louisiana's first Louisiana Oral Health Report Card. The coalition decided to create this report card to share this data to highlight the state's oral health needs to create change. The report card is comparable to those compiled by other state oral health coalitions. We use methodology from those states to create this report. However, in the future, we plan to ask assistance from the Association of State and Territorial Dental Directors, ASTD, in developing our own grading criteria specific to each indicator. This report is published and available on the Summit webpage. Please be sure to access it along with all of the other wealth of information located there. Well Ahead is working across the state to share crucial resources and provide programs and services needed to address health disparities and empower the most vulnerable populations. We are proud to partner with the other members of the Oral Health Coalition to bring you this summit focused on this important and timely issue. Today, you will receive an abundance of information on how to achieve oral health equity. At a glance, we'll have 3 general sessions presentations. You'll hear from 2 national partners followed by a local partner. This afternoon, there will be 4 breakout presentations occurring simultaneously, including dental workforce disparities, effective school and community prevention practices, teledentistry initiatives, and oral health disparities seen in special populations such as HIV/AIDS community, individuals with disabilities, and senior adults. As we strive to move Louisiana's communities forward, we need each of you to stay committed. Buckle up and join us on this journey, reducing oral health disparities, which requires the will to act. Without further ado, we bring to you the 2021 Oral Health Summit, The Road to Achieving Oral Health Equity in Louisiana.